Okay, so in this exercise, we are going to extract the information from the clinical data set from the TCGA data. Here are some of the files that I have already uploaded into the Dropbox. You will probably have the same file with you. So what I'm going to do now is I'm going to open the first file here, which labeled as the PAAD clinical. So when you open this file, what you will see here is that, well, there's a lot of columns and information. Let me expand the column A here. So here you can see all the annotations of the clinical data here. So, well, I highly encourage you to explore and look at some of the data that is available here. But for our exercise today and also for your study, there are a few things that I want you to pay attention to. First of all, this is the patient barcode. I will just highlight this. So what it says here is basically under this column, you have a unique barcode that represents each of the patients. So you can see the different barcode here, and that will be the same denominator that you will use for patient identity in the subsequent data set as well. And second, you will also see this column here. Okay, so which mentioned that, okay, patient days to death. So here it basically show that, okay, how long the patients have survived after their first diagnosis. For example, in this case here, the patient survived for 244 days after diagnosis and so forth. You can use this information if you want to plot the overall survival curve. Now, if you scroll down further, then I will also show you where you can find the drugs information. So the drugs information is actually hidden here in this row. You can see that the patients have received gemcitabine, and some other drugs as well. So these are the information that is important. And subsequently follow that is actually the clinical response, which show that, okay, whether the patient is complete response, clinical progressive disease, and so forth. Now, the last features that I want to show you is basically there's also another information about here, okay, the death uh, reason. So they will also tell you, well, remember, just now I mentioned to you is that you also have the information about how long the patients have survived, but here there's also information about the main reason of the patient's death. In this case here, some of the patients, for example, okay, in these patients, he or she actually died of pancreatic cancer. So if you want to plot disease-free survival, then you can actually combine this information with the survival days. Then you can actually plot both the overall survival and also the disease-free survival. So next, what I'm going to do is I'm going to copy all this information into a more manageable format. So I will need this. So I'm going to copy this and then create a new sheet here. And what I'm going to do is I'm just going to transpose it so that, well, it will be in a column like this. Is much easier to manage. I will also copy um, this information and then transpose it so that it will match to each other. So, and of course your drug information. Okay, so we'll copy that. Okay, and the last would be the patient death uh, reason. So now you have some of the most important information that is needed for most of your study. So if you want to, you can also use the auto filter to look at some of the data. For example, if you just, these are all the drugs that is being used to treat the patients in this cohort. For example, in our study here, we are just interested in gemcitabine HCl injection, or Gemsa. Gemsa is a brand name for gemcitabine as well. So then here now you have all these patients that have received the gemcitabine, and subsequently you can also filter whether, okay, how many patients have complete response, for example, and also how many patients have stable disease or clinical progressive disease. Okay, so in our study here, I think what we will do is we are going to define the responder as someone who has complete response or partial response, whereas the non-responder as clinical progressive disease or stable disease. That's all for now. Thank you.